The first thing I'm going to do is grab my doctor's orders and compare them to my MAR. Once I check that they are the same, I'm going to perform hand hygiene and grab all of my medications and supplies. My doctor ordered 10 units of insulin, subcutaneous now, and 25 milligrams of an IM injection of Phenergan, IM injection now. I'm then going to look at my patient's medication history, medical history, allergies, height, and weight. Once I do that, I'm going to check my vials. I'm going to grab my Phenergan vial. The expiration date is 4/2021, and the integrity of the vial is good. The vial states that there are 25 milligrams of Phenergan per 1 milliliter. So for my IM injection, I'm going to grab 1 milliliter. I'm going to place my needle on so that it's ready. I'm going to grab my alcohol pad and I'm going to clean the top of the vial. Once I do that, I'm going to remove the cap of my needle and pull 1 milliliter of air into my syringe. I'm then going to place my needle into the vial and push the air in. I'm going to flip my vial and pull 1 milliliter of medication, ensuring that there are no air bubbles. Once I do that, I'm going to use the scoop method and put my cap back on. I'm then going to screw it off and place this into the sharps container. Without touching the hub, I'm going to screw on a new needle, and now my IM injection is ready. I'm now going to grab my insulin and my insulin needle and check my insulin vial. The expiration date is April 2021, and the integrity of the bottle is good. I'm going to get an alcohol pad and wipe off the top of my vial. And then I'm going to grab my insulin needle, remove the cap, and pull 10 units of air. I'm then going to place the needle into the vial and push my 10 units in, flip it, and grab 10 units of insulin, also ensuring that there are no air bubbles. I'm now going to use the scoop method, and now my insulin is ready. Once I do that, I'm going to do my second check against my MAR. I'm going to check my MAR, my vials, and my syringes to ensure that everything is accurate. I'm then going to grab another nurse and ask her to check my needles and my MAR to make sure that it's accurate. Once I do that, I am now ready to go into the patient's room. I'm going to grab my MAR, my syringes, my vials, my alcohol pads, my gauze, and my gloves. I'm going to knock on the patient's door, introduce myself, and explain why I'm there. I'm going to do hand hygiene and ask the patient for 2 identifiers, their first and last name and their date of birth, and check it against their wristband. I'm then going to ask the patient if they have any known allergies. I'm going to ask them about place and time to ensure that they are alert and oriented. Once I do that, I'm going to triple check my MAR against my syringes and my vials. I'm then going to ask my patient if they have had these medications before, if they know what these medications are being given to them for, and if they have had these medications before, where they were last inserted. I'm then going to check and assess their lower extremities for movement. If the patient is capable of moving themselves into the correct position for the injections, they will do that now. If not, then I will delegate somebody to help me move the patient to assure that they are comfortable for the injection. 3 places that you can do an IM injection are at deltoid, the vastus lateralis, and the ventrogluteal. The 2 places you can do the subcutaneous are the lateral part of the arm and 2 inches away from the umbilicus. I'm now going to put my gloves on, and I'm going to start with the IM injection. The patient informed me that the last place they received the Phenergan was the right vastus lateralis, so I'm going to be placing the injection in the left vastus lateralis. The proper landmarks for the vastus lateralis are 4 finger widths below the greater trochanter and 4 finger widths above the patella on the lateral side of the thigh. Before I clean off the area, I'm going to inspect and palpate to make sure that there are no lumps from previous injections. I'm then going to grab my alcohol pad and I'm going to clean off the area to ensure that it is sanitized. I'm then going to grab my syringe, remove my cap, and use the Z-track formation on their muscle. I'm going to place my hand on the skin, ensuring that I do not touch the area that was previously cleaned, and I'm going to pull their skin taut. I'm then going to inject their skin at a 90-degree angle and use my other hand to stabilize the syringe. I'm then going to push the medication in over 5 to 10 seconds and leave the syringe in for a few more seconds to make sure that none of the medication gets onto their skin. Once I pull the needle out at the same angle that I put it in, I'm going to immediately put gauze on the injection site and place my needle into the sharps container. I'm now going to do my insulin injection. My patient informed me that the last area that they received their insulin injection was their left lower quadrant of their abdominal. I'm going to do it in the right lower quadrant. I'm going to inspect and palpate the area for any lumps from the previous injection. I'm then going to use my alcohol pad and clean the injection site. My patient is 5'6", 250 pounds, so I'm going to make sure that I grab at least 2 inches of skin and insert my needle at a 90-degree angle. So I'm going to pinch and insert. Once I insert the needle, I'm going to release the skin, stabilize my syringe, and push the medication in over 5 seconds. I'm then going to pull the needle out at the same angle that I insert it and immediately place gauze on the injection site and place my needle into the sharps container. I'm then going to remove my gloves, clean my area, and perform hand hygiene. I'm going to lower the patient's bed. I'm going to raise 2 handrails, and I'm going to give my patient the call button. I'm going to make sure that my patient is comfortable and is free of pain. I'm then going to inspect my injection sites and palpate for any lumps, bruises, redness, swelling, and make sure that they're comfortable. And then I'm going to document my medications on my MAR.